Hey everyone, welcome to another episode of Discussions with Dr. G. I'm Dr. G, and today we're diving into what environmental health actually means. Because let's be real, this isn't the stuff that keeps most people up at night, unless you're like me and can't stop thinking about air filters at 2 a.m. So, environmental health. Big picture, it's about how our surroundings, the stuff we touch, breathe, drink, all that connect right back to our health outcomes. I always say it's not just what's in your fridge, it's what's coming out of your tap and what's floating around in the air when you walk down the street. Now, the big determinants here break into two camps. There's the obvious physical stuff, air and water quality, lurking toxins, those weird chemical smells from next door's mysterious, quote, home improvement project, and obviously the buildings and streets around us. But don't forget about the social side. Poverty, discrimination, access to good care. You can't exactly live your best life if you can't see a doctor or if the only grocery store within 10 bus stops is also selling motor oil in the same aisle as bread. So, if you ever took an epidemiology class, you probably have seen the triangle thingy. The epidemiological triangle. Agent, host, and environment. As fun as it sounds, it's not the Bermuda Triangle. It's just how we look at the interaction between people, germs or toxins, and the environment. Now, if I had a nickel for every time a student asked me if upstream meant getting in a canoe, by the way, upstream is all about those policy level choices in infrastructure like emission standards and city planning. While downstream, that's where you actually see health fallout. Think asthma rates, cancer clusters. I still remember having a passionate discussion at my previous school in our community class, students comparing two neighborhoods, and one had way higher asthma rates. Turns out their built environment, more traffic, fewer trees, crummier housing, sets the scene. It was a light bulb moment for a lot of them. It's not just genes, it is in fact your zip code. So, hazards. This is where things get spicy. Well, spicy if you count mold or radon gas. Climate change, wildfires, hurricanes. Yeah, those are obvious baddies. But let's not forget plain old air pollution, water problems, pests, or even stuff like that lovely greenish fuzz growing in your basement. Built environments? Oh, housing and workplaces. Get interesting here. Chemicals from factories. Asbestos that seems to be hiding in every old school. Lead pipes still somehow existing in 2025. And radon, which, let's be honest, sounds like the name of a cheap superhero. Then there's the job-related stuff. Nurses? We love our PPE. Well, sort of. And occupational exposures could be anything from bloodborne pathogens like HIV to Hep B and even Hep C, to awkwardly lifting patients or just dealing with, coworkers microwaving fish in the break room. Okay, that's more of a psychosocial hazard, and I made that up. But really, ergonomic and chemical exposures are in fact real risks. I'll never forget this one simulation I ran for my students. It was during COVID when all of our classes were online. I have them all practicing proper PPE technique during what was supposed to be a simulated chemical exposure. I'm explaining the serious stuff when my cat Luna does this dramatic leap onto the desk, totally breaking the tension. Students giggling, and I'm there trying to look professional in a full face shield like I'm getting ready for a moon landing. But honestly, those skills matter, especially thinking about real-world crises. Wildfires up north cause terrible air quality and a rash of asthma flare-ups, or water disasters like what happened in Flint, Michigan. Just devastating folks already struggling. The connections between environment and health are sometimes eye-wateringly obvious. Other times, just a steady drip of everyday exposures that add up over time. Now, you might wonder who's supposed to fix all this? Enter the alphabet soup of agencies. The EPA, Environmental Protection Agency. 1970 vintage, basically in charge of making sure we're not living in a giant toxic dump. Then you have OSHA, who steps in for workplace safety. Same here. There's the Clean Air Act, Safe Drinking Water Act, all those legal guardrails to keep things at least semi-decent. On the nursing side, organizations like the ANA push for the precautionary principle. That's better safe than sorry with a fancier hat. And making sure we're fighting for environments that don't make people sick in the first place. And if you're a nurse, or even just thinking about being one, you'll want to know about the I Prepare. That's a little assessment mnemonic for hunting environmental risks. Think starts with exposures at home, and yeah, you might find yourself peering out of a car window doing a windshield survey of a community. Once you find risks, you link them to actual health outcomes. That polluted neighborhood, probably seeing a ton of asthma. That's your diagnosis. Then you set some SMART goals. No wild promises, just real, measurable stuff that ties back to what the community actually needs. Implementation is all about prevention. Primary means like vaccines, clean water, PPE. Secondary is where we screen, like testing for lead or asthma. Tertiary, that's managing the ongoing chronic issues. And evaluation, well, if something's not working, we go back and try something else. Nurses got to be adaptable, all right? The cool part is our impact isn't just about bedside care. Advocacy and education are huge. After that local chemical spill last year, for example, I volunteered with community groups to teach folks what to look for, how to keep safe, and even how to demand better protections. Nurses drive community changes, and sometimes it means being loud enough to get the right people's attention. All right, if there's one takeaway here, it's this. New RNs, you're not just protecting patients inside a clinic. You're stepping into a world where recognizing environmental risks, using your skills in the community, and speaking up for justice is key. Safe, healthy environments don't just happen. They're made. That's all for today, but trust me, we're just scratching the surface. Catch you next time, and don't forget to check your air filters.